Well, good morning, you all. My name is Derica Oliver. I am the president of HIV and AIDS Peer Educators, and I'll be your mistress of ceremony. So we're going to begin this program with a greetings from Miss University of Arkansas at Pine Bluff, Miss Landy Watley.
Good morning.
Good morning.
To Chancellor Calvin Johnson in his absence, Mr. Bennett, and all other administration present here on this morning. We gather here today for what is known as World AIDS Day. Therefore, I not only simply stand before you to greet you, but to challenge you. The theme of World AIDS Day 2012 is getting to zero new HIV infections. In order to get to zero, we must get to work. And our work is needed because African Americans face the most severe burden of HIV of all racial ethnic groups. The University of Arkansas at Pine Bluff dares you to reach out your hand into the darkness and pull another hand into the light. If you have much, give your wealth. If you have little, give of your heart. So in the words of a wise man, let us not be defined by our yesterdays. Instead, let us be defined by what we can achieve tomorrow. Thank you.
Okay, next on our program, we have a solo from Daniel Farmer.
I'm so excited to be here and honored to be asked to sing. The song says, He's Able. I hope you enjoy. Exceedingly, abundantly, above all you could ask or think, according to the power that worketh in you. God is able to do just what He said He will do. He's gonna fulfill every promise to you. Don't give up on God, 'cause He won't give up on you. He's able. Say God is able to do just what He said He will do. He's gonna fulfill every promise to you. Don't give up on God, 'cause He won't give up on you. He's able. Exceedingly, abundantly, above all you ask or think, according to the power that worketh in you. Say God is able to do just what He said He will do. He's gonna fulfill every promise to you. Don't give up on God, 'cause He won't give up on you. He's able. He's able. If y'all know, sing with me. He's able. Now y'all sing it. Let's go. Okay, just sing. He's able. Yeah. He's able. Come on, be my choir. Said He's able. He's able. He's able. He's able. He's able. He's able. Yes, He is. No matter what you're going through, He's able to bring you out of it. He's able. Through your trials, through your infections, through your trials, through your infections, God is able to do whatever He needs to do. He's able. God is able. No matter what you're going through, God is able. No matter what you go through, He will bring you out of it through grace and mercy. Yeah. God is able. Just believe in His word. Just believe in His word. No matter what you go through, no matter what you go through, my God is able. Oh, yes, He is. No matter the situation, no matter the circumstance, just know God is able. Oh, yes, He is. I may not have it in music, but I'm still gonna praise God through everything that I've been through. I know He's able. He's able. Yeah, He's able. Oh, He's able. Oh, He's able. He's able.
All right, we're going to move along. We're going to have the introduction of our keynote speakers by Mercedes Jackson.
Today, I will be introducing Lewis Henry and Carrie Farmer Kaufman. Lewis Henry is alumni of the University of Arkansas at Pine Bluff, where he earned a Bachelor of Science degree in Business Administration. He is a certified professional facilitator trainer with certificate obtainments in the addressment of alcohol and drug abuse prevention and treatment. Lewis is currently a candidate for a master's in management and administrative science with a concentration in healthcare organization management at the University of Texas at Dallas. He is a community activist, leading catalyst, and public speaker in the areas of substance abuse addiction, public health, relationships, spiritual, community organizing, and advocates. Carrie Farmer Kaufman lives near Fort Smith, Arkansas. She is the mother of a beautiful daughter. Carrie was diagnosed with HIV on November 4th, 2010. 2 days later, she was diagnosed with AIDS. She was told to make plans for her daughter and her funeral. Carrie was not ready to quit. 2 years later, she is still fighting and making a difference in the community. She is now undetectable. She is a full-time student, an advocate, activist, and most importantly, a better mother. She knows that she has a voice for this cause, and she uses it at the best of her abilities.
Okay, how's everybody today? That's real good. It's an honor and a privilege to be able to stand before you today. And it's definitely always an honor to come back on this campus here at UAPB, because UAPB did things for me that caused me to be in the position that I'm in today. You know, and it's always an honor to have the opportunity to come back on this campus and especially to give back. And I'd like to thank Ms. Bass and all the rest of the faculty, staff, students that made this possible and happening today and actually inviting me to come here. I also like to thank C2EA, and I got to watch the acronyms. C2EA stands for the Campaign to End AIDS, and it's an advocacy group, and it's a national group that have chapters across the United States. In the Southwest region, Ms. Bass asked the Southwest region to send someone to speak, and they chose me to come speak. And I'm very honored for that, because they could have chose a whole lot of other people to come here and speak to you guys today. So what I'm going to do is that I'm going to give you guys a Weight Watchers version, skinny version. Not going to keep you here all day. I'm not going to speak long, because they didn't give me a time limit. If I get too long, cut me off. So, I want to talk a little bit first about World AIDS Day and where it come from. In 1988, the World Health Organization decided to have an awareness day, and they called it World AIDS Day, a day across the world that people would stop, educate, and bring awareness and hope to reduce the stigma around HIV and AIDS. In 2011, probably in 2010, they made a decision that from 2011, well, they made a decision that it was time out for HIV across the world. So they came up with a theme of 0. from 2000, that will go from 2011 until 2015. And my hopes is that we don't have to go that long, that we don't have to have that many more World AIDS Day, and a lot of people say celebrations, and I don't want to say celebration, but World AIDS Day awareness days. Hopefully we can end that, you know. And in that, I think she mentioned the theme is zero. Let me make sure I say it correctly. It is getting to zero. Zero new infections, zero deaths from AIDS-related illnesses, and zero discrimination. So, and what I'm going to do is talk a little bit about that theme and a little bit about advocacy over the next few minutes. And the first one I want to talk about is zero new infections. You know, why is that important? I want you guys to think about, why is it important that we no longer have another individual in this world, in this country, in the state of Arkansas, here on the campus of UAPB, or any other black, historical black university, be infected with HIV? Just think about that. Why that's important. That's important because the fact is we are dealing with a disease that is preventable. There is no reason that any other person should be infected with HIV or any other STD, because they are all preventable. You know, it's also important because young black men and women between the ages of 13 to 24 continue to accelerate in high numbers and high new infections. According to the CDC, last week, right before World AIDS Day, they released that. They also said that blacks were 3 times higher, young black people, I'm only focusing on young black people, that it was 3 times higher than the chances were 3 times higher that a young black person would be infected with HIV than a Latino or Hispanic person. In that report also stated that we as black people, young black people, I still consider myself young, that we were 8 times more likely to be infected than a white person. Think about that, 8 times more likely. And we only make up 13% of the general population. There's something wrong with that number when there's a preventable disease. You know, there's something wrong with that number. And then I look at, someone sent me the other day, from the health department. I think it's the CPG plan from the health department. And in that plan, it talked about that last year, there was 280 new cases, new infections in the state of Arkansas. 54% of them were of African Americans. And then that report also stated that African American and Latino women made up between the ages of 20 and 29 made up 53% of those numbers. And African American and Latino men in this state made up 36% of those numbers. You know, people are still being infected and there is a preventable disease. There's something wrong with that. There's something wrong with that. And then we go on to the next. They said we want to achieve 0 deaths from age-related illnesses. That's very important in today. We shouldn't have people dying from age-related illnesses. And why we shouldn't have people dying is because there are life-saving medicines today. But people are still dying because of the lack of access to treatment and medication. You know, one of the great things, you know, all people living with HIV and AIDS should have the right to treatment and care. Not only treatment and care, but also the right to medication. You know, we have a lot of states across this country, and I don't know how many, I think there's about 8 or 9 states that have a waiting list for ADAP. And ADAP is the AIDS Drug Assistance Program that's funded by the government. Thank goodness we don't have a waiting list in the state of Arkansas. There's no waiting list here. And I'm not going to say yet, because yet would mean that there's one to come. You know, so people are waiting to get people that can't afford that may be getting treatment and can't afford medications are on waiting lists in America, in the great America that we are. Out of all the tax dollars that we spend and that we put in the pot, there's still people that we can't take care of in some of these states. That's a problem. That is a real problem, I feel. When we have drugs that people could be taking and they can't get them for whatever the reason may be. You know, and then the next piece comes to achieve 0 discrimination. We shouldn't even be dealing with discrimination. You know, as a result of discrimination brings about has a great impact upon why people are still getting infected. You know, when we start talking about discrimination, it brings on the fact of stigma. You know, and stigma has caused our people as African Americans, the stigma around HIV has caused a lot of people to become infected or not receive the care that they need. You know, so we have to really, really think, and so we can get to 0, and it's important that we come to 0. But in order to get there, it's going to take some work. You know, it's going to take some work, and it's going to take everybody, not just the people sitting in this room. You know, it's sad today that there's a lot of empty seats here, but maybe people are all taking their final examinations. That would be okay. But it's a good thing that we do have some seats filled. Because I know there was a day and a time that probably nobody would have been in this auditorium. You know, about 18 or 19 years ago, when I started to do volunteer work and I started to work in public health, we would have events and we would be happy if 3 people showed up, you know, and especially in the African American community. So we've come a long ways, but we still have a long ways to go. We still have a long ways to go. And when I talk about achieving that 0, what I want to do is talk about what we can do as a group of people collectively. Because what it's going to take is going to take all of us, not 1, not 3, not 10, but it's going to take all of us in order to bring that to 0. And in order to bring that to 0, what we're going to have to do is that we're going to have to come together. We're going to have to join forces with advocacy groups such as C2EA, such as this Southern AIDS Coalition, and other advocacy groups across the nation. And we're going to have to go to our government. We're going to have to go to private and public, non-profit, for-profit entities. We're going to have to make sure that all organizations of faith, all religions are on board. We're going to have to get every community leader and every community member on board and on task in order to make sure that we get to 0. You know, and she says I have 2 minutes. I told you guys I was going to give you the skinny version, the Weight Watchers version. So it's going to take all of us making a commitment. We're going to have to do some of the things that they did in the 50s and the 60s, right here in this state, in Little Rock, Arkansas, and so that black people could get education just as white kids got education. So that we could start going to white universities if we choose to. Some of those things that had to be done. We are going to have to do that if we're going to make it through and end this disease and end this epidemic. You know, those civil rights leaders such as Martin Luther King did not fight both day and night for us to come here and allow something that's preventable to kill us. You know, I was getting ready this morning to leave, and I stumbled across this. I'm not that organized, so I have stuff everywhere. And I picked this up at the African American Museum in Detroit a few weeks ago. And it shows here, and some of you guys don't know nothing about this. I don't know that much about this. But it says this is a mouse pad, and it says history, 1962. That's the year I was born. And it says ladies, and it says men, and these are restrooms, and then it says color. We don't have to go there. And somebody fought for us to go there. And they didn't fight for us to be able to go into these other restrooms and not have to be, for the lack of discrimination, for us to come here and allow HIV to take us out. So what I want to do is I want to charge each and every person that's sitting in this audience today is to think about one thing that they can do in order to help us achieve 0. Whether it be Karen, I think is her name, is going to tell us about C2EA and how to actually join, whether it be to take forces with C2EA, whether it be to talk to a friend, whether it be to create a actual event such as this one. And I'm going to challenge you to actually do that over the next year. So I got a sign that said 0, so I think it's time for me to stop. Okay, thank you guys, and thank you, Ms. Bagley.
Good morning. First of all, I want everyone to look at their program. In the back, it says notes. I want you to pull out a pen or a pencil, and I want you to write down any question, thought, feeling, anything you have about HIV and AIDS, because I believe there's going to be a question answer time at the end. And I want to challenge you to ask me or Lewis any question you have about HIV and AIDS. You can ask us anything you want. You can ask me anything you want. So I just want to start with that. And then second, I'm going to talk to you about Campaign to End AIDS. Campaign to End AIDS is more of an activist program. It's where you go out and do stuff. If you're scared, it's hard to do. Being an advocate can be easy. You can start by being an advocate by just talking to your friends, doing Facebook. I have like 3 or 4 Facebook pages. But being an activist is actually going to Congress, going to Capitol Hill, or like we just went to Florida for the final presidential debate and held up signs that said, our next president, we want you to do this. We want rights for everyone. We want this. And we were in their faces. And we actually made it on the news. And it was amazing. And it was actually my first time being part of an activism part. So it is kind of nerve-wracking being an activist, but it's very exciting as well. The Campaign to End AIDS is a diverse, exciting coalition of people living with HIV and AIDS, their advocates, and their loved ones. Together, we're demanding that our leaders exert the political will to stop the epidemic in the U.S. and abroad once and for all. And then, who is the Campaign to End AIDS? Since 2005, Campaign to End AIDS has demanded that our leaders fully fund quality treatment and support services for all people living with HIV everywhere, ramp up HIV prevention at home and abroad guided by science rather than ideology, increase research to find a cure, more effective treatments, and better prevention tools, fight AIDS stigma, and protect the civil rights of all people with HIV and AIDS everywhere. Understand the vital role safe and stable housing plays in prevention and treatment, and incorporate housing as a structural intervention for both. And you can join, excuse me, today we'll be having a booth where you can sign up. I am the chair for Arkansas, and I would love to meet anyone that's interested in helping us out in Arkansas. While representing the epidemic on the community, regional, and state levels, thousands of members develop strategies through activists and advocacy networks. We have phone conversations, conference calls. We talk about different things that are going on in different states. Like I know that the end of this month, they're going to be talking about the healthcare reform in Little Rock. And I and my daughter have been asked to go there and speak as a mother living with HIV. They want my face and my daughter's face to be seen so those legislators can see that people truly are living with this, and it is really hard. And I have a little daughter that's very brave, and she's going to stand there and say, yes, it is hard to have a mommy that's living with this. So, and we all back each other up in Campaign to End AIDS. I can call on anyone anywhere in the United States and say, okay, this is what's happening in Little Rock, we need a team. There'll be a team from all over the U.S. down there on that day. We'll have posters and everything, because it's all about numbers. Numbers brings in people, and it brings in power too, and it also helps you to feel the love and the strength. So you can go to, write this on your paper if you decide not to come, because, wait, I'm not going to say that because I know everybody's going to come to the rest of the meetings. C2EA.org. Get involved and join C2EA today. So that's my little plug for C2EA. And does this come off? Are you guys in high school? What? Junior high, awesome. Is there high school students in here? Oh my gosh. I'm completely humbled to be here right now. We are not allowed to go to certain schools to speak about HIV and AIDS, so this is amazing. Thank you so much for letting me be here. I'm so glad that you guys are here. I want all of you, not just the kids, no pun intended, to look at me. I had a great life. I had a mother and a father that were married. I traveled. I did a lot of stuff. I got married when I was 25, and I had a baby. And I had what you would call a perfect life. Well, then 5 years later, I find out that my husband is not attracted to me, he's attracted to men. So we got divorced. That's not the catchy point. I want you to think about this, and I want you to listen to my story because it's very, very important. Not only are African Americans on the rise, but women are on the rise, heterosexual women. Because gay men are having sex with heterosexual women and not telling us. And that's another way that it's getting spread. You need to know this. I didn't get it from my husband. The day I was divorced, I went out and I met someone. And I was lonely and decided that in the heat of passion, a condom wasn't needed. That was September 7th, 2010. October 7th, 2010, I was dying in the hospital. They had no idea what was wrong with me. My blood pressure was 80/20. They had no idea what was wrong. They had never seen anything like this before. I was lethargic, couldn't feel, couldn't see, nothing. They told my mom that I was gonna die. And then finally, after 2 weeks of being in the hospital, they said, well, she has pancreatitis, send her home. They sent me home, and I was back 2 weeks later. So that's 1 month. September 7th, I met this guy. Within 2 months of meeting this guy, I was told that I was HIV positive. 2 months. It doesn't take 10 years, like some people say. It only takes one time of not using a condom, or a dirty needle, or not being honest. Take it from me, people are not honest. You have to protect yourself. They make female condoms, they make regular male condoms. They have clean needles, you can buy clean needles. You have to protect yourself. When I was told that they had to test my daughter, I thought I was gonna die all over again. Because they thought I had had it forever, because I breastfed my daughter. Do y'all know that that's one of the ways you can get it? There's only 4 ways that you can get it. Do you all know the 4 ways? Semen, breast milk, vaginal fluid, and blood. That's it. Write it down if you don't know it. If you don't know it, learn it, share it. You're not gonna get it from touching me. You're not gonna get it from my spit. You're not gonna get it from my sweat. Those are the only 4 ways. What's the 5th way? Huh? Oh, skin graft, if I'm bleeding. Well, I'm not gonna bleed on any of y'all, so don't worry about that. Yeah. Well, I'm not gonna bleed on any of you. But I want you all to look at me because I'm obviously healthy now, thanks to God. And thank you for that song. Thank you for that song. I lost 100 pounds and I lost all my hair. I went bald. And I was a beautiful bald girl. And I'm getting my hair back now. I have to walk with a cane and But you know, I'm 33 years old and I have to use a cane sometimes, and I'm on Medicare. Medicare, you think, no offense to some people, but Medicare, you think that's old people insurance. But because I've had AIDS, they don't know if I'm gonna get sick again. My immune system is not as well as a regular 30-year-old person. If someone comes to me sick, I could get sick. And that's where one of the stigma and the questions lie, where one of the myths lie. You don't need to be afraid of me. I need to be afraid of you. If you have the flu, if you have strep throat, please don't come near me. Please don't come near anyone that has HIV or any type of immunodeficiency problem. But I just want you all to know that this is real. I am really living with it. I never, ever in my wildest dreams thought that I would get it. But I did. And I'm so honored to be here to be able to speak. I'm honored to be alive. I know that God gave this to me because He knows that I'm not afraid to talk to people. He knows that I will go up to somebody's door and say, no, you're wrong. And this is the truth. And I am extremely blessed to have the strongest rock, that's my daughter, who is just interviewed on the news, on our local Channel 5 News. They did a little family report about what it's like being a mother and a daughter, and she told the news that she was my doctor. And it was very cute, and she knows all about it. She'll tell you exactly what you need to do, and she'll tell you that mommy's blood is poison, but she's okay. But my point to you all in your young lives is, I'm not stupid. I was young once. I know I can't go to your schools and tell you this, but I can stand here and tell you this. Think about it. Think about your loved ones. Your decisions, your 1 second decision of not protecting yourself does not just affect yourself. It affects everyone. Everyone. My mother still worries about me traveling, thinks that I'm gonna die, thinks that something's gonna happen to me. She watched me almost die in the hospital because of something stupid that I did. And it was preventable, and now I'm having to live with it for the rest of my life. So if you can learn anything from me today, always, always take a minute to think before you make any kind of decision when it comes to risky behavior. And always get tested. Know your results so that you don't have to get full-blown AIDS. You can get on the medication and get taken care of. Thank you.
Thank you. Okay, now we're going to have some statistics and HIV replication by Ms. Cherie Joyner-Robbins and Ms. Carol Jackson.
Good morning, you all. I won't be up here long because I started losing my voice last night. And apparently, for my grandson, I sound like the Lion King's father. So I don't want to drive you all crazy and annoy you with my voice. But I am Cherie Joyner-Robbins. I am an HIV and AIDS trainer with the Delta Region AIDS Education Training Center. We primarily train clinicians, doctors, nurses, physicians around the state of Arkansas. We're part of actually a national organization. There's an ATC and AIDS Education Training Center in every state in the United States. But our focus is here in the Delta region. We focus on Louisiana, Mississippi, and Arkansas. Stats today are actually going to be given by the wonderful Ms. Giselle Hudson. She's an HIV and AIDS prevention employee for the Arkansas Department of Health. So without further ado, I will give you Ms. Hudson. Can we give her a warm round of applause and welcome? She came a long way to be here.
I'd like to thank everybody for coming, and since we have a lot of young people in the room, I think I need to talk to you specifically. But first I'd like to say there are approximately 1.1 million people living with HIV in America, and yet 1 out of 5 do not know it. As far as African American youth, Nearly 25,000 are infected, estimated to occur each year among the youth ages 13 to 29. So like every 30 minutes, 2 teenagers are infected with HIV somewhere in America. Every 30 minutes, 2 teenagers. And we don't want it to be you. Young African American men, particularly gay and bisexual men, as well as black heterosexual women, are severely impaired. It's like black women, we're the face of AIDS. Among those ages 13 to 29, the rates of infection among black men are higher than those of any other race. The rate of new infections among young black males ages 13 to 29 is 7 times as high as that of young white males and 3 times as high as that for young Hispanic males. So for young black females ages 13 to 29, the rate is 11 times higher than that of young white females and 4 times higher than Hispanic females. The vast majority of young black women with HIV are infected through heterosexual contact, so that's unprotected sex. And many are diagnosed late in the stage, so by the time they find out, it has already progressed to AIDS for many of them. Unprotected sex and sharing needles are the 2 main ways that we're being infected. Nobody thinks it'll happen to them. Oh, not my man, oh, not my woman. We don't do that, but you need to just assume that everybody's at risk. Everybody's infected with something until you know for sure, to wrap it up. In the hood, they got Pookie giving tattoos. Try not to get a tattoo from Pookie because his needles might be infected with somebody else that he gave a tattoo. So if you're gonna get a tattoo or body piercing, since that's the thing these days, go to a real tattoo parlor. Don't let Pookie give you a tattoo in the hood, okay? That's the main thing. Try not to get into any fights with people at school because if someone's HIV positive and you punch them in the mouth and they're bleeding, and then they bite you on your arm and you're bleeding, you can be infected. Or if the blood splashes in your eyes, your nose, or your mouth, you can be infected. So try to be, try not to get into fights with people. Just assume everybody got something until you know for sure they don't. And eventually we are gonna know somebody that's HIV positive in our communities, loved ones, friends, schoolwork community. Show some compassion. Don't be afraid to touch them. You can still hug them. That's not how you get it. You get it from having unprotected sex. So if your loved ones are infected with AIDS, give them a hug. We all need hugs. That's not how you get it. And if they come to your house to eat, don't give them a paper plate and a plastic fork, okay? Let everybody have a paper plate if it's gonna be like that. But that's not how you get it. So don't give them a paper plate and a plastic fork if everybody else got a real plate. And the other STDs also can lead to HIV. If you have herpes, that's like a gateway for HIV because of the blisters and the sores. So other STDs encourage HIV, syphilis, herpes, gonorrhea, any of those. And some of these diseases you can get even with a condom on. You can still get herpes, you can still get HPV by skin-to-skin contact. So you need to be very, very careful of who you have sex with. Just assume everybody got something until you know for sure. And I guess I got off track with the stats because this other gentleman talked a lot about stats. And since we have young people in the room, I wanted to, let you guys know that pulling out is not a method. Pulling out, oh, you want to get pregnant, I'll pull out. That does not work, okay? Doesn't work. As soon as a guy get an erection or hard-on, there's pre-ejaculatory semen, pre-nut at the tip of the penis. So as soon as you stick it in a girl's vagina, she can get pregnant. So just know that. These are just little things that you need to know that could save your life. So even with a condom on, you can still get herpes, skin-to-skin contact. You can just be hunching people and get it. Seriously. Genital warts, also called HPV, is skin-to-skin contact. They have a shot out now, a vaccine called Gardasil. So if possible, try to get that vaccine. It's 3 shots in a 6-month series to protect you from HPV. Last year they said boys should also get the shot to protect you against HPV, also called genital warts. So it's 3 diseases out here, no cure for. They all start with the letter H. No cure for HIV, AIDS, no cure for herpes, and you can get herpes just kissing people, for cold sores and fever blisters. It's also in the genital area. 1 out of 4 people walking around with herpes down there, and HPV, no cure. So those are the diseases no cure for. If you don't have them now, you don't have to get them. Just always assume people are infected until you know for sure. Just because they're cute and drive a nice car and live in a nice house doesn't mean that they're not infected. So think selfishly when it comes to yourself and your health. Always wrap it up. Should I give a stat or two, or is that okay? Okay. Let's see the stats. Well, we represent only 14% of the United States population. We account for almost half of the people living with HIV in the United States, 44%. Approximately 1 in 16 black males will be diagnosed with HIV during their lifetime, 1 out of 16. For black females, 1 in 32 black females will be infected with HIV in their lifetime. For Hispanic, 1 in 106 Hispanic Latina women will be diagnosed with HIV. And for white and Asian women, 1 in 526 will be infected with HIV in their lifetime. I talked about how black women and MSM, young gay bisexual men, we are the face of AIDS. And it's not like we're having more sex than anybody else. Many of the reasons that we're infected more than other groups is because of poverty. A lot of people don't have health insurance. They don't go to the doctor. Another one, sex for drugs, drugs for sex. Homophobia in the black community. We don't want to talk about gay stuff. We want to act like it doesn't exist or it's the worst sin in the world. So we need to stop being so judgmental and be honest with people, because that's affecting our rates too. And the prison is 8% higher in the prisons, and men come out of prison and come home to their wives and girlfriends and give them to them also. But now at least we test them in this state when they come out of prison, so they know if they're infected. But it's up to them to tell their loved ones. We can't tell their loved ones for them. So those are the main reasons that we're being infected with HIV. So just know we're the face of AIDS, and we don't have to be. And always wrap it up until you know for sure. Thank you.
Thank you, Giselle. She's gonna go 100 miles round trip just to be here today. A lot of times working in this field, we work on our own dime. We don't get paid for the work we do. So I appreciate you and your team for coming, Giselle. Thank you. Next, we're going to have my coworker, Ms. Carol Jackson, speak to you all a little bit about common HIV myths and misconceptions. It's 30 years into the epidemic, a little bit over 30 years. And a lot of things that are so basic about HIV that are true and false, people still don't know. So just to ensure that we're all on the same page about the basic facts about HIV transmission prevention, Mrs. Jackson is going to give you a little education today. So please welcome her.
Good afternoon. Myth number 1. I can get HIV by simply being around people who are HIV positive. The evidence shows that HIV is not spread through touch, tears, sweat, or saliva. You cannot contract HIV by breathing the same air as someone else who has HIV, touching a toilet seat or a door handle after the HIV positive person has touched it, drinking from a water fountain, hugging, kissing, shaking hands with someone who is HIV positive, sharing eating utensils with an HIV positive person, using exercise equipment at the gym. You can contract HIV from infected blood, semen, vaginal fluid, and mother's breast milk. The most common ways that people become infected with HIV are through having unprotected sex, sexual intercourse with an infected partner, through injected drugs using dirty needles, such as used by someone who is infected, as a baby of an HIV-infected mother during pregnancy, labor, delivery, or through breastfeeding. Myth number 2, I don't need to worry about becoming HIV positive. New drugs will keep me well. Yes, HIV drugs are improving and extending the lives of many people who are HIV positive. However, many of these drugs are expensive and produce serious side effects. None of these drugs can cure HIV. Also, drug-resistant strands of HIV can make treatment and increasing challenges to keeping you healthy. Myth number 3, I can get HIV from a mosquito. Because HIV is spread through blood, people have worried that biting of a blood-sucking insect might spread HIV. Several studies, however, show that no evidence to support this, even in areas with lots of mosquitoes, cause HIV. When insect bites, they do not inject blood of the person or animal they have last bitten. I must pause there for just a moment. Remember that a mosquito do not have an immune system, and that's what made it not able to carry HIV from one person to the next. Myth number 4, I am HIV positive, my life is over. In the early years of HIV epidemic, the death rate of AIDS was extremely high. Today, HIV drugs allow HIV positive people and those with AIDS to live much longer, normal, and productive lives. Myth number 5, I'm straight and I don't use IV drugs, I won't become HIV positive. Most men do become HIV positive through sexual contact with other men or through inject drug use. However, about 16% of men and 78% women become HIV positive through heterosex contact. Myth number 6, if I am receiving treatment, I can't spread the HIV virus. When HIV treatments work well, they are reduced the amount of virus in your blood to the level so low that it does show up in blood tests. However, research shows that the virus is still hiding in the other areas of the body. It is still essential to practice safe sex so that you won't pass the virus on to someone else. Myth number 7, my partner and I are both HIV positive, and there is no reason for us to practice safer sex. Practicing safe sex where condoms or use dental dam can protect you both from becoming exposed to other potential drugs-resistant strands of HIV. Myth number 8, I could tell if my partner was HIV positive. You can be HIV positive and not have any symptoms for years. The only way for you and your partner to know if you are HIV positive is to get tested. Myth number 9, you can get HIV from oral sex. Yes, it's true that oral sex is less risky than some other types of sex. However, the rare you can contract HIV by having oral sex with either man or woman who is HIV positive. Always use a latex barrier such as dental dam during oral sex. Myth number 10, you can tell if someone has HIV or AIDS by looking at them. Weight loss, rash, etc. People with HIV more often than not feel as healthy as anyone in this room. The only way you knew if you have HIV is to get tested. For people who think that they have been exposed to HIV, having a test and receiving a negative result, which means they are not infected with HIV, you can stop the worrying. The ABCs of safer sex. A, abstinence. You have a choice to have sex or not. choose wisely. B, be monogamous. If you are sexually active, limit the number of sexual partners that you have, can greatly decrease the potential exposure to HIV virus. C, condoms. Always use a brand new condom with each sexual act. Thank you.
Next, we have Savannah Nietzsche-Teresi. She is a longtime employee of our organization, although she hasn't worked with us in the last 2 years or so because her grant funding ended. However, we are very fortunate to have her back on our team in a new capacity. She's going to be working alongside me and my manager, Derek Newby, the program coordinator for the AETC here in Arkansas, as an HIV educator. Now, she's not been on the job for very long right now, only for about a week or so. But she's been brave enough to come up here and talk to us about HIV medications and why they're so important in HIV treatment. So please welcome Savannah.
Good afternoon. I'm going to talk about HIV medication adherence. Now, the question is, what am I going to do if I find out that I am HIV positive? What to know is that there are medications out there. And the HIV medications are called antiretroviral therapy, and they are highly very active. And they are very powerful to slow the progression of HIV, and they prevent the virus from replicating in the body, and they decrease the amount of the virus in the infected blood. And they allow us to live healthier and longer lives. Now, the question is, how long is it going to take me to be AIDS case? Normally, it's going to vary according to each individual, but they have found out that the main range is between 5 to 10 years. And that's the shortest time, but the longest time, it can be 10 to 15 years. So that's a disease that is going to be, to take a long time to show. So we have to remember that. So we cannot just say, since I am HIV positive, I am AIDS case. You have to go to the doctor. The doctor is going to tell you that. It is important when you find out that you are HIV positive, it is very, very important to decide that you have to go on medication. And remember, I just said, being on medication, the medication is going to help you get back to your life. Now, the question is, because there is a lot of fear behind it. Once you find out that you are HIV positive, you just go down. You feel really down. And once you feel down, to come back and then to even think that you have to go to the doctor, sometimes it takes a while. So you need to think that, hey, there are medications out there. I need to bring myself up and then get ready to take my medication. And that's a question you have to discuss with your doctor. But you have also to remember that even though these medications are there, they are not going to cure the disease. So you are going to be on those medications for a lifetime. That's why being ready is very, very important. Once you get on those medications, you are not going to skip them. You are going to keep taking them every day. So that's something to think about. So when I used to work with the patients, this is how I was telling them, to bring them to take the medication, to be in that habit. I just told them, I said, you know what? When you wake up in the morning and you go, what are the things that you do before you go outside? Then they tell me, I go take a shower. That's good. You never forget to take a shower. And then I say, then what do you do? And I say, oh, I dress up. Then I have to put my clothes on. Very good. You never forget to put your clothes on. So when you think about that, you cannot go outside without putting your clothes on. So when you are HIV positive and you have decided to take your medication, remember, just connect to that. Remember, I cannot go outside without my clothes on because I'm going to look funny. So I better take my medication because that's how I'm going to stay healthy. And then you get into that habit and you stick on it, and it will come so easily. And the other thing, the other reason why you have to do like that, if you stop the medication, then it's going to be, your body start to be resistant to the medication, and you don't want that to happen. It's just like those antibiotics. When you get those antibiotics, they tell you take all of them, because if you stop, then the medication is not going to work. So it's the same for the HIV medicine, and that's what we call the drug resistance. Now, resistance means that HIV drugs that previously worked well to keep the HIV levels low in your body may no longer work for you, and that causes you to become very ill. And there are other things that you have to put into consideration. And the other factors, and they are simple, and there are things that we do every day. It's about the food we eat. It's good nutrition. Now, why good nutrition? It's because healthy eating can greatly improve your health outcome. So what we put in the mouth in terms of food, it's going to show out, okay? And once we take the good food and the medication, then we are going to feel good. And it is also important to monitor your calorie intake. So don't take too much. You have to watch your weight. You don't want, because the medication, it has side effects. And most of these medications, they act up on the heart. They may make you become too big. And then there is, when you become too big, there is that interaction. So you have to control that. So if your weight is just a good weight, then you have a good chance. And then there is the question of drugs, illegal drugs. So it's what we call substance abuse. So it's really good to avoid them because they come and they interact with those medicine, and they make those medicine not work for you. Now, the only way to know that you have HIV, is to get tested. It's better to know. if the HIV infection is detected early, your chances of long-term healthy survival, it increases significantly. So we have a good chance to survive. But again, I'm going to summarize it. You got to remember that before you get on the medication, check on yourself. Check if you are ready, because you are not going to stop. And then keep going to the doctor. Take your medication and have your lab done, because that's how the doctor is going to see if your medication is working. And then after that, when you go home, eat healthy and avoid using drugs. When I say drugs, it means those street drugs, and also I mean don't drink. Alcohol is going to interfere with most of this medication. And then lastly, smoking is not a good deal. Get tested and know your status.
One thing that Savannah talked about was getting tested and knowing your status early. A lot of people always ask me, I've been really blessed to have some really wonderful, diverse jobs in my career. And a lot of people ask me, how on God's green earth did you end up being an HIV/AIDS trainer, educator? And my story briefly is that my very best friend actually died of HIV infection, complications actually. We went to college together, graduated together, and 2 years later, at 24 years old, he was dead. He had been HIV infected for several years, and he simply just was not taking his medications. And I know now, in retrospect, and of course going through all my trainings and whatnot, that his life could have been spared. Another caveat also is that he did not know that he was HIV infected well into his HIV infection. He'd probably been infected for about 6 years, because he engaged in sex with an HIV positive guy when he was in high school, and he traveled to California to live with his father. He came back and he started getting sick slowly but surely. Finally got tested, and at age 24, he had left. And I assure you, I still miss him to this day. He's my very, very best friend in the entire universe. And although I've tried, to find people comparable to him, to not necessarily replace him, I still can't replace him. And all I say is, get tested, know your status. Don't assume that just because you haven't had any risk factors that you know of, that you're HIV negative, because I don't want you to be the next one. So I'm going to drive you guys crazy for a couple seconds longer with my voice and talk to you about HIV replication. HIV replication is really just tells you how HIV actually reproduces in the body. This is one subject that we don't get a chance to talk a lot about in communities. As far as formal trainings with clinicians and whatnot, of course we talk about HIV, the life cycle and replication and how it reproduces. But in talking to the World AIDS Day UAPB Planning Committee, Ms. Bass thought it would be a good idea to explain to y'all how HIV actually gets active in the body and why people get ill from HIV infection. So very briefly, I'm going to talk about that. You look at a slideshow here. One thing also, there's this wonderful takeaway in your World AIDS Day program today. In the very middle of the book that UAPB had created, this one right here, is one of the best simple tools to explain how HIV reproduces in the body that I've ever seen. So please take a look at this when you get a moment, and also hold on to it. I assure you, as I assure Mrs. Bass, we're more than likely to start using this in our trainings. It's really just that good. So what does HIV stand for? Thank you, ladies and gentlemen. Human immunodeficiency virus. H for human, because it only affects humans. You can't get it from monkeys or other animals. It's human transmitted. I is for immunodeficiency. Your immune system is what keeps your body strong, helps you fight infections and viruses and illnesses. Well, HIV actually comes in and creates a deficiency in your immune system. It starts killing it out, basically. It's one of the very few viruses in this world that can actually come in and attack your immune system and start killing it off. And B, because it's a virus. Viruses are kind of like a body with no head. They're incomplete. So in order to make copies of itself, it has to find a human host cell, invade those cells, steal the proteins, make new copies of itself, protect itself, make an outer shell, and exit. And what happens basically in the body is that there are cells in our immune system called CD4 cells or T cells. In your body, T cells are the little soldiers that come to, like your first line of defense, that come to your rescue when you're infected with a virus or bacteria. They come in, they surround it, typically kill off and destroy it. With HIV, it's different. When HIV comes into the body, it actually attacks those soldier cells and kills those cells off. So now your body's left pretty much defenseless, or at the very minimum, very, very weakened. So you look at the slide up here, if you look to the right, this is an actual CD4 cell. It's right there. The green with all the little red dots on it, that's an actual CD4 cell. That's just one big cell, the glob. The little red dots you see are actually hundreds of HIV viruses attacking that cell, that one cell. And actually, after this cell's under attack so many times, you start dying off. You need a certain number of CD4 cells in order to stay healthy, for your body to be able to fight infections. And once HIV enters the body, it starts killing them off very quickly, sometimes slowly but surely. This is a challenge we have with HIV. Some people get sick slowly. Some people get sick very quickly, as in Carrie's experience. My friend, it took about 7 years for him to start showing signs and symptoms. With Carrie, it's what, about 2-3 months? Because everybody's immune system is different. So we look at this little time clock here, which I think is so wonderful in your book. Let's go from step 1. It's like a little clock. What happens first? When HIV enters the body, the CD4 cell is produced to fight off the HIV virus. The CD4 cell in this demonstration is the gray cell. The HIV virus is the red illustration. Step 2, what happens? The antibodies cannot kill HIV. So HIV enters the CD4 cell. Step number 3. Number 4. Once the HIV cell is inside the CD4 cell, it starts making copies of itself. And it makes many, many copies. This happens millions of times a day if you are not on medications to help fight the HIV. Step 5. Once the HIV has made copies of itself, all these little copies exit your CD4 cell and get into your bloodstream. Step number 6 on the clock. When CD4 cells die, the amount of HIV in the blood goes high, increases significantly. Step number 7, as the CD4 cell count goes down, the immune system starts to weaken, and this is when you start to get sick. This can all be prevented, of course, as Carrie said earlier, as Savannah touched on earlier, as Lewis touched on earlier, because HIV does not have to affect you or your life or anyone that you love. It can be prevented. It's just so simple to prevent it. Practice the ABCs that Carol mentioned earlier. A, you can choose to be abstinent. Abstain from sex. Like I tell my daughters, my sons, my husband and I, we have 7 children. And we tell that, yes, I know it's a haul. But we tell them, although you started having sex, you can always make a decision to stop and reassess your life. And think about, is this what I want to do right now? Am I mature enough to handle this responsibility? But be monogamous. If you choose to have sex, and that's for you, limit your partners. The less partners you have, the fewer partners you have, the less you're exposed to HIV. This is common sense, right? The fewer partners, the less risk you take. And C, if you do decide to engage, always use a barrier. Always use a condom, a brand new condom, each time you have sex. I'm going off topic because this information here in this booklet, you can read anytime. But looking at the crowd here, the high school crowd and the college crowd, I want to give you guys some common sense advice that actually works. So those ABCs do work. Abstinence, be monogamous, use condoms each and every time that you have sex. Like Carrie said earlier, it only takes one time with the wrong person to change the course of your life forever. So think about that. All right? Thank you all. Next, we're going to have Mr. Herman Kraut of the UAPB HIV and AIDS Peer Educators.
I'd like to thank everyone for coming. Immediately following the assembly, we'll be having a march. You get your balloons, and then we're going to march to the hyper and have the balloon release. The students, we are providing you all with lunches, and immediately following that, HIV testing will take place in the locker room at the hyper, immediately following the balloon release. Thank you.
I would like to thank everyone for coming out and coming to the program. We really appreciate it. As Herman said, if you all could exit out through here and just line up outside, and we'll hand you your balloons. And once again, give a round of applause to everyone who came and spoke. And this concludes the program. Thank you.